Live from wherever news is breaking, this is ABC Action News.
Plus, we've got the bottom line on Botox for you. Coming up, this woman will wipe away her wrinkles live right here on ABC Action News. This is a live event you don't want to miss.
This is the needle, this is the Botox, and this is the patient who has agreed to let us inject the Botox during a live demonstration. Wendy, how are you feeling?
I'm feeling pretty good. How about you?
You're feeling nervous, aren't you, Wendy? Our patient is feeling nervous. Botox was the #1 non-surgical procedure, cosmetic procedure done in the United States last year. Why? What does it do? And is it safe? We have an expert plastic surgeon on hand to do the demonstration and answer all your questions coming up. Don't go away. Live at Dr. Christian Dreschen's office in Clearwater, where we're going to have a live Botox demonstration in just a second. But first, I want to introduce you to our patient. This is Wendy DePass. She's a 38-year-old woman who thinks she frowns a lot and that her face just looks stressed. Let me see that frown line you're so worried about. She's agreed to have injections done live in just a minute, but first I want to give you some scoop on Botox. She is one of 1 million people who had this done last year. Botox injections are up 83% since 2001, probably because the FDA has approved Botox for this use. The average cost of a series of Botox shots, about $422. 88% of the people who have it done are women, and 12% are men. But get this, it's on the rise for men. In fact, this is Pierre, who is Wendy's husband. He had Botox injections done, what, about a month ago, Pierre?
Yeah,
about a month ago.
Yes.
Right. So we're going to show you his before and after pictures after his wife gets the live demonstration. And that is all coming up after weather.
Well, tonight, moving on, we are revealing the buzz behind Botox.
ABC Action News anchor Linda Hurtado joins us now live from Clearwater. Linda, we're about to see someone get Botox right here live on air. I know the patient, her name is Wendy, so she probably is going to do very well. Is she ready to say goodbye to her wrinkles?
Well, aren't we all? I think Wendy is a little bit nervous, and I want to just warn the viewers real quick. You will see a needle injection into the skin. You may see a little bit of blood, and also you're not going to see a lot of dramatic change with Wendy because it takes a while to see it. So we have before and after pictures after the procedure. Let's get to Dr. Dreschen so he can begin. First of all, what is Botox? Because I know a lot of people shy away from it because they think it's a toxin.
Yeah, Botox is a purified protein that's been used for over 10 years in ophthalmology. So it's a very safe product. It's really placed under the skin to inactivate small muscle of facial expression, okay? So we're going to put some in between the brow. You see that big crease going on sometime, and also in the crow's feet where you have another crease forming on. By doing this, it's also going to release the brow a little bit and elevate a little bit the brow after the Botox takes effect. Now, the Botox might take between a few hours to a few days to take action, okay? So
Okay, we're going to go ahead and begin now. Wendy, are you ready?
Yeah.
it's a very tiny needle, so it's not something that's very uncomfortable. It's placed right underneath the skin like this, okay?
Does the Botox actually stay right where you're injecting
It
it?
stays exactly where it's put because we put it right underneath the skin where these small muscles are, okay? So what I'm doing right now is deactivate that muscle around the eye, okay?
Wendy, what's it feel like? This is your first time, so.
Yeah, it doesn't feel like anything really. Very.
It's a very tiny little needle, so it's not something that's really as a... So we're going to try to decrease the activity of this muscle to give you the crow's feet, essentially, okay?
Now, and how long does this last? A couple of months, or?
No, about up to 4 months. It varies a little bit. Now, sometimes you have to put a bit more Botox, especially when people have a very strong muscle. What I'm doing right now is to leave the Botox in some area of this little muscle so that the muscle will be inactivated in that specific area, okay? So he's not going to inactivate everything. He's going to leave the other muscle working, but in that small area, we're going to see the effect of the Botox.
Okay, you keep going, doctor. Let's take a look at some before and after pictures so we can show people at home.
Make a difference.
Okay, the first thing you may notice is, hey, it looks like that woman's frowning. Well, that is really the point here in the before picture. When the muscles are paralyzed, then you see the after picture, and even if you try to frown like that on the left, you can't, and that's the point. A lot of people go around frowning. Let's see the second picture. A lot of people go around frowning and they don't even realize it. So with these Botox injections, you cannot physically do that for about 4 months. Now let's take a look at the pictures of Pierre that we promised you. Now, okay, you might be thinking to yourself, I don't see a dramatic difference. So I'm going to ask you at home to focus in on where you see his eyes, just on the eye area. Because if you look there, you will see a lift. His eyes do look a little lifted. He, I don't know, looks bright-eyed. He doesn't look quite as tired. And that's the point of Botox. It's you know, it's maybe the first step, really, to some other kind of cosmetic procedures. Let's come back live. Dr. Dreschen, as you're finishing up, I know someone told me that you have actually 16 people lined up to do this tomorrow. Why so popular?
Well, Botox is maybe the first shy or timid step in the plastic surgeon's office. So you can see a little bit what we're trying to do, and do it with virtually no downtime. I mean, basically, this little stick will disappear within a few hours. So pretty much this thing, the effect of Botox will occur without you knowing what's happening, essentially.
Okay, so, Doctor, we got to wrap up. Thank you so much for the live demonstration. I just want to leave on one note, Wendy. Did it hurt?
No.
It felt okay? All right, well, there you've had it, your live demonstration of Botox. Back to you all.
So you seems easy enough.
Walk around like this all the time. It's another layer.
She's going to look great. Stay with us.
Thanks for watching tonight. See you tomorrow.
Good night.
ABC Action News is associated with the Scripps Networks family.